On the 18th of March 2009, British actress Natasha Richardson was skiing at the Mont Tremblant Resort in Quebec, Canada, when she fell and suffered a head injury. At first, the injury didn't seem severe, and Richardson declined medical attention. She reportedly joked about the fall and initially appeared lucid. However, within hours, she began experiencing headaches and was later admitted to a hospital in Montreal. Despite receiving medical attention, Richardson's condition rapidly deteriorated. She was transferred to a larger hospital in New York City, where her husband, actor Liam Neeson, and her family were by her side. Tragically, Richardson passed away on March 18, 2009, at the age of 45. Stay tuned as we dissect the science behind brain hemorrhage today in Forensic Archives. From accidents to violent assaults, brain hemorrhages are at the forefront of countless forensic investigations. An autopsy revealed that Richardson died from an epidural hematoma. The impact from the fall had caused blood vessels in her head to rupture, leading to the buildup of blood and pressure on her brain. An epidural hematoma is one of the 4 major forms of cerebral bleeding. Epidural means that the bleeding occurs between the skull bone and the so-called dura mater, a hard layer of tissue surrounding the brain inside the skull. The brain is surrounded by 3 layers of protective membranes, the so-called meninges. The innermost layer is the pia mater, which translates from Latin to soft matter. It's a very thin membrane that is wrapped tightly around the brain. The second membrane is the arachnoid mater, named for its resemblance to a spider web. In the space between the arachnoid and the pia mater, some vital blood vessels of the brain flow. Also the cerebrospinal fluid, a colorless bodily fluid that surrounds and protects the brain and spinal cord, flows here. The third and outermost membrane is the dura mater, the hard matter, a membrane that envelops and protects the brain and is attached to the skull. These 3 membranes are the only part of the human brain that can sense pain. If you have ever had a headache, it means that the meninges are irritated, not the actual brain tissue. That's why a brain tumor, for example, usually doesn't cause pain as long as the meninges are not affected. The epidural hematoma most often results from traumatic head injuries, involving the temporal bone of the skull, especially the so-called pterion, which is the weakest part of the human skull. Beneath this area flows the middle meningeal artery that can tear from high-force impacts, even when the skull is not broken, leading to massive arterial bleeding inside the skull. This kind of bleeding is typical for victims of car crashes, violent assaults, or other high-impact accidents. The second kind of brain bleed is the so-called subdural hematoma. Contrary to the epidural hematoma, this is a venous type of bleeding that occurs between the dura mater and the arachnoid mater. It is often caused by traumatic head injuries. However, in most cases, it is not as life-threatening as an epidural hematoma because venous bleeds are usually slower and veins have lower pressure than arteries. Subdural hematomas occur due to the rupture of so-called bridging veins that span between the arachnoid mater and the dura mater. This is why subdural hematomas occur more often in young children and elderly people. They have, due to their young or old age, smaller brains compared to their skull size, increasing the tension on the veins bridging the mobile brain and the immobile dura mater. Subarachnoid bleeding occurs from the rupture of vital vessels in the space between the arachnoid mater and the pia mater. It can be caused by high-impact trauma or occur spontaneously by the rupture of arterial aneurysms, which are congenital bulges of arterial vessels in the brain. These bulges can rupture without warning and are a common cause of sudden unexpected deaths in seemingly healthy adults. Often, people with high blood pressure and smokers are affected. Last, we have intracerebral bleeding, which is bleeding inside the brain tissue. This is typically caused by head concussions or skull fractures. Intracerebral bleeding can also occur spontaneously from chronically high blood pressure, arterial aneurysms, or congenital vessel disease. An interesting aspect of traumatic intracerebral bleeding is the Coup-Contrecoup Mechanism, which has high forensic significance. When the head is struck, the brain hits the inner skull at the point of impact, causing bruising, bleeding, and swelling in the brain tissue at that site. This is called a coup injury. After the initial impact, the brain rebounds and hits the opposite side of the skull, causing further damage. This movement can shear brain tissues and usually deals more damage than the initial impact. This mechanism, however, only occurs when the skull is mobile as in a fall or car accident. If the skull is fixed, for example, by someone holding it down and hitting it with a blunt object, no Coup-Contrecoup injuries will be found. Skull fractures often result from head trauma, and bone splinters pushed into the brain tissue can cause additional damage. It is not uncommon to see a combination of 2 or more different types of brain bleed in a person after an accident. Symptoms of traumatic brain bleeding can range from light headaches to instant coma and death. Thus, a person who has suffered a head injury should always be closely monitored and, if in doubt, checked by a doctor. Especially epidural and subdural bleeding can cause a lucid interval where the affected person doesn't feel any symptoms while the bleeding increases in size. When a critical pressure point is reached, sudden coma and death can occur. Other, not-so-subtle symptoms are sudden, agonizing headaches, so-called thunderclap headache, epileptic seizures, sudden loss of motor function, and anisocoria, characterized by unequal pupil size. The mechanism of death in cerebral bleeding is mostly the same. The skull is a rigid, bony structure that cannot expand, so the increased pressure pushes the brain through the only exit, the foramen magnum, the large hole at the lower end of the skull. However, this is also where the brainstem is located, the part of the brain that controls critical functions like breathing, heart rate, and consciousness. If the upper part of the brain presses on the brainstem, the tissue dies, and the affected person loses their consciousness, their respiratory drive, and eventually the heart stops beating. If a person with a suspected brain bleed is admitted to a hospital, a simple CT scan will reveal the injury. Depending on the extent of the hemorrhage, neurosurgeons may perform surgery. For example, by opening the skull to relieve pressure, flushing out the blood, or closing a bleeding vessel with a clip. This is not always feasible, however, depending on the extent of the bleed and the accessibility of the bleeding vessel. If a person has already suffered major pressure damage to their brainstem or other vital brain areas, surgery will not be able to save the patient, or worse, produce an outcome where the patient will be severely physically disabled, possibly dependent on ventilators or feeding tubes for the rest of their lives. Intracerebral pressure is also a common cause of death in many other neurological pathologies, like brain tumors, strokes, or drug overdose. Brain hemorrhage is a serious and often underestimated risk, capable of causing severe and sometimes fatal consequences. Natasha Richardson's tragic story serves as a sobering reminder of how critical it is to seek immediate medical attention after any head injury, no matter how minor it may initially seem. Thank you for joining us on this deep dive into the dangers of brain hemorrhage. If you found this video informative, please give it a thumbs up and share it with your friends and family to spread awareness. Don't forget to subscribe and hit the bell icon to stay updated on our latest content.